Over more than 3 decades of clinical practice, a clear pattern has emerged among people over the age of 50 who experience persistent low back pain. In most cases, the discomfort comes from a single area near the base of the spine that becomes stiff, irritated, and painful over time. This area is known as the lumbosacral joint, the lowest joint in the spine, and it is especially vulnerable to wear and tear as we age. Understanding how to recognize this problem, what causes it, and how to address it with simple movements can make a lasting difference in comfort and mobility. The lumbosacral joint often becomes restricted as the spine undergoes natural aging changes. When this joint loses its normal movement, it commonly produces a band of pain across the lower back or discomfort that feels deep and stubborn. Many people notice pain or difficulty when straightening up after sitting, especially after long periods. Bending and lifting can become uncomfortable, and simple daily tasks such as putting on socks or shoes may feel stiff or painful. A sore, tight lower back first thing in the morning is another frequent sign, as is pain when rolling over in bed at night. One of the most common reasons this joint becomes irritated is poor sitting posture. When the lower back sags backward while sitting, especially on soft couches or while sitting up in bed, the lumbosacral joint is pushed out of its optimal position. Over time, this repeated strain causes stiffness and inflammation. Sitting with feet lifted while leaning back worsens the problem by increasing the backward sag of the spine. To protect the lower back, it is important to sit all the way back in a chair and support the natural curve of the spine. Keeping the pelvis in a neutral position, relief often begins by gently guiding the joint back toward its normal alignment. One effective approach is to lie face down on a firm surface and slowly prop yourself up onto your elbows. Before holding the position, notice how it feels. If it causes sharp pain, it may indicate inflammation, and this movement should be avoided. If it feels comfortable or mildly stiff, relaxing in this position for about 30 seconds can help reverse the effects of prolonged sitting. Over time, the duration can be increased, and gentle leg movements may be added if they feel comfortable. Another helpful method is to gently open the joint through controlled rotation. Lying on your back with knees bent and thighs raised, slowly move your knees from side to side within a comfortable range. This motion mimics hands-on techniques used by manual therapists to restore movement in the joint. Afterward, allowing one leg to hang off the side of the bed while the body remains relaxed can provide a gentle stretch that encourages mobility in the lower back. Gravity does most of the work, making this a safe and effective daily practice. Strengthening the deep, stabilizing muscles of the lower back is also essential. Research shows that weakness in a small but critical muscle called the multifidus greatly increases the risk of recurring low back pain. A simple way to activate this muscle is to start on hands and knees with the spine in a neutral position. Gently tighten the abdominal muscles, then lift one arm and the opposite knee slightly while keeping the body steady. Holding this position briefly builds strength and coordination without excessive strain. Over time, this can progress to lifting the opposite arm and leg fully while maintaining good alignment. Finally, the muscles that keep the pelvis level play a major role in protecting the lumbosacral joint. When these muscles are weak, the pelvis tilts and places extra stress on the lower spine. Standing on one leg while slowly moving the other leg in controlled circles challenges balance and strengthens the outer pelvic muscles. The movement should be slow and deliberate, continuing only until light fatigue is felt. Practicing this regularly helps stabilize the pelvis and reduces irritation in the lower back. When these movements are performed consistently and with care, they work together to restore mobility, improve strength, and reduce stress on the lumbosacral joint. Over time, many people notice reduced pain, better movement, and greater confidence in daily activities.